Hi, this is Dr. Arun Vishnar, and today in this particular lecture, I'll be talking about hypertension and constipation. That is, hypertension and constipation, in many cases, they are interrelated. Nowadays, in clinical practice, whenever a patient with gastrointestinal complaints reach a gastroenterologist, usually, the gastroenterologist, what they do, they will just examine the gastrointestinal part of that particular patient. That is, their view is tubular. They forget that each and every part of body is interrelated with each other. GI tract is connected with brain. All the functions of GI tract are being monitored from brain. If there is any problem in GI tract, it may precipitate hypertension, it may precipitate arrhythmias, it may precipitate cardiovascular problems. So, all the systems are interrelated. So, whenever we are examining any patient of any specialty, one should thoroughly examine the patient as a whole. What I have seen in the clinical practice, in many cases, patients reach me, they complain of chronic constipation. In these patients, when I measured the blood pressure, I found that blood pressure was raised. In many patients, I gave antihypertensives. In many patients, I didn't give any antihypertensives. I only treated the constipation part. When I treated the constipation part, what I saw that the hypertension was cured by itself together with constipation. When constipation went away, hypertension was cured. Blood pressure was controlled without any antihypertensive medications. So you can you can say that constipation and hypertension, they are interrelated. It is a vicious cycle. If patient develops constipation due to any cause of constipation, he may precipitate hypertension. Blood pressure may be raised. So thorough examination is necessary. Now, usually in patients with hypertension, if you give antihypertensive drugs, these antihypertensive drugs may also cause constipation and vice versa. Constipation can cause hypertension. Whenever the patient is constipated, if there is any problem in colon, that is, there is any colon inertia, or inertia, I mean to say, when colonic movements, they are hampered, they are slow, they are not proper, it is called as colonic inertia. That means fecal matter to travel large colon from cecum to sigmoid colon, if it takes a long time, that is called as colonic inertia. So patients with colonic inertia may have systemic hypertension. They may develop systemic hypertension. What happens in colonic inertia? The bowel flora, that is bacterial flora of the intestine, that is changed. There is disorder in the bacterial flora, and because of this change in bacterial flora, there are chances of atherosclerosis. There are chances of development of many cardiovascular problems because of atherosclerosis. So it stimulates atherosclerosis if microbacterial flora of intestine is changed. So whenever there is colonic inertia, then in colonic inertia, if there is constipation, it may lead to hypertension. If there is any hindgut dysfunction means dysfunction of sigmoid colon and sigmoid colon and rectum. If there is any dysfunction of this rectosigmoid portion of the gut, then in that case also many a times patient develops hypertension. And as soon that particular disorder of hindgut is cured, blood pressure will come back to normal. If there is any outlet obstruction of gastrointestinal tract, outlet obstruction means if there is any problem with anorectal region, whenever there is any problem with anorectal region, then in that case also hypertension is precipitated. Because of the anorectal problem, patient will strain at defecation, during defecation, and when he strains during defecation, whole of the reflex is stimulated. As a result of that, blood pressure rises and pulse rate goes down. In the second phase, blood pressure will fall and pulse rate will go up. And in the third stage of straining, again blood pressure will rise. And if patient is continuously doing this process again and again, then in those cases, patient, whenever you record the blood pressure will be raised. So many times what we do in the case of constipation, you are blindly treating it as a case of hypertension. Usually there is no hypertension. That problem is being precipitated by constipation. So try to cure that constipation. So once the constipation is cured, then in that case the hypertension will go off by itself. On the other hand, if patient is hypertensive, then antihypertensive drugs can precipitate constipation. So in these cases, again, you will have to give medication to control constipation. That means it is a vicious circle. If patient is having constipation, he may develop hypertension, and if patient is hypertensive, because of antihypertensive drugs, he may develop constipation. So this is a vicious cycle. So you will have to break this cycle. You will have to do proper follow-up. You have to properly monitor that particular patient. And first of all, as a gastroenterologist, I will suggest you that if patient is constipated, always measure the blood pressure properly by your own, not by your nurse or by your compounder, but you measure your blood pressure by own. You means doctors. Doctors, they should measure blood pressure by themselves. Nowadays what it is seen, there usually some nurse or some compounder is measuring the blood pressure and just writing down that this is the blood pressure, and many times there is error in the blood pressure. So whenever a patient comes to you with constipation, always examine properly for the hypertension, and if he is turned out to be hypertension, first you try to control the constipation. Once constipation is controlled, then again you measure the blood pressure. If it comes down to normal, then it is okay. If it comes down to normal, then it is okay. And if it is not coming down to normal, then in that case you add antihypertensive drug. Secondly, if blood pressure during the first visit, if blood pressure is moderate to severe, then in that case don't wait for the cure of constipation. You start with antihypertensive drugs and also give the drugs, whatever drugs are required for constipation. And once the constipation is cured, then monitor his blood pressure and rule out if there is hypertension or it is not a hypertension, it is related to constipation. So you will have to rule out that. Thank you.